Hello everyone, I'm so excited to introduce you to my book, Clear Aligner Technique. Clear Aligner Technique is published by Quintessence Publishing. It is written in a very easy to read format with short paragraphs. At the beginning of every chapter, you'll be able to see the contents of each chapter. There are numerous illustrations in the book and 35 case reports of different types of malocclusions. I'd like to introduce the book to you in a series of questions. Who is this book written for? This book is for all levels of dentists who would like to treat patients with clear aligners. Whether you're a first-year dental student, a graduate student in orthodontics, or a general dentist or orthodontic specialist. No matter your level of experience, this book will help you guide you through understanding the basic principles of orthodontic diagnosis and treatment planning, designing a ClinCheck software plan that meets your treatment goals and objectives, and giving you clinical tips to carry out the treatment plan to get the clinical outcome that you desire. As you know, technology is always changing with many new innovations. Clear Aligner Technique was written from a diagnosis and treatment planning perspective. It discusses time-tested orthodontic principles like biomechanics, anchorage, and occlusion, and then explains how to apply them to clear aligners. So this book is written for anyone who wants to treat malocclusions with clear aligners. Does this book apply for other clear aligner systems or only for Invisalign aligners? This book is first and foremost a textbook in orthodontics. Although the cases treated in the book are Invisalign clear aligners from Align technology, many of the principles in clear aligner treatment will apply to any clear aligner system. When a clinician decides to treat a malocclusion with clear aligners, they have to first make a diagnosis and then a treatment plan. In the treatment plan, there will be certain tooth movements required, such as extrusion, intrusion, rotation, and distalization. As doctors, we have to select the aligner system that is able to accomplish the type of tooth movements we require to correct the malocclusion. I attended a course in clear aligners. Why do I also need this book? When we attend a course or a conference, sometimes the topics are relevant to our practice and the patients that we see, and sometimes it is not so relevant. We may learn many tips and tricks to bring back to our practice for certain types of cases. Many doctors, however, want a systematic way to learn clear aligners with scientific evidence and a comprehensive overview for different malocclusions. At the end of every chapter of Clear Aligner Technique, you will find a bibliography with the latest research on clear aligners. This book was written like a clinical handbook. When a clinician plans to treat a case, they can refer to the chapter on that specific malocclusion. For example, a deep bite case. They would read Chapter 8 on deep bite treatment, and based on the information in Chapter 8, they will be able to make a diagnosis on what causes a deep bite malocclusion. There will be some discussion on the biomechanics and anchorage requirements for deep bite correction. They will learn about innovations they can design into the software, like precision bite ramps and optimized deep bite attachments. They will understand how staging the tooth movements in a specific sequence will give better clinical predictability. Then each chapter has at least 3 case reports of that type of malocclusion treated with aligners, so that you can see how the recommended biomechanics, software design, and staging patterns work out. Let me show you an example of a deep bite case that is featured in a case report from Chapter 8. A Class 1 deep bite malocclusion treated with smart force features as bite ramps and power ridges. This is a teen male patient who's 15 years old. And when you look at his oral hygiene, you realize that he's not the best candidate for fixed-edge wise appliances. He presents with a Class 1 deep overbite malocclusion and minor crowding in both dental arches. Both upper and lower incisors are retroclined, and there is a steep curve of spine in the lower arch. Here you can see the smart force features built into the ClinCheck with power ridges and bite ramps. Upper and lower incisor intrusion to correct the deep overbite and level the curve of speed. From the overjet view, you can see the precision bite ramps appearing on the lingual of the upper incisors. On the superimposition view, you can see the amount of upper and lower incisor intrusion that's been programmed into the clincher, the leveling of the curve of speed in the lower arch, and anchorage attachments that are required on the first premolars. On the upper occlusal view, you can see the precision bite ramps on the lingual of the upper incisors. And in the lower occlusal view, you can see lower incisor alignment without significant alteration in the labiolingual position of the incisors. Here are the final records at 10 months. You can see the deep overbite has been corrected. Upper and lower dental midlines are coincident. The patient started with a good class 1 buccal occlusion, and this was not changed in the treatment. I am not an orthodontist. Can I use clear aligners? Yes, all dentists have some basic training in orthodontics in dental school, and there are many advanced orthodontic courses that you can attend to learn more if you're interested in orthodontics in general dental practice. The secret to being successful with clear aligners is case selection, case selection, case selection. In Chapter 3 of Clear Aligner Technique on case selection, it discusses how to recognize cases that range from simple to difficult. For example, the light blue is simple, the medium blue is moderately difficult, and the black indicates that it's an advanced case. If you have a minor crowding case that you're planning to treat with expansion, proclination, and interproximal reduction or IPR, that's going to be a simple case to treat. If you have a moderately crowded case that requires a low incisor extraction or distalization, that case is going to be moderately difficult. And finally, in a severe crowding case that requires premolar extraction, that's going to be a very difficult case that may require specialist treatment or a high level of experience with clear aligners. May I use clear aligners for difficult orthodontic cases or complex malocclusions? The answer is yes, of course. A proper understanding of the biomechanics of clear aligner technique, together with the capability of digital treatment planning and proper treatment protocols, will lead to successful aligner treatment. This book lays out protocols for each type of different malocclusions. You can see each protocol is summarized at the end of every chapter. In this example, in Chapter 13, you can see the summary box that outlines the principles of premolar extraction treatment. Clear aligner technique as a textbook has caused a paradigm shift in the way orthodontists perceive clear aligners. Before the book was published, most orthodontists thought of clear aligners as a simple orthodontic appliance that treated class 1 malocclusions with minor crowding and a lot of interproximal reduction or IPR. Most thought that clear aligners were not able to finish a case to the same standard of excellence that we expect from fixed braces. When this book was published, many orthodontists were amazed at the excellent standard of finished cases treated with clear aligners only, and also at the range of malocclusions in the book, from class 2 and class 3 malocclusion to premolar extractions and orthodontic surgery cases. Can I find clinical cases with different degrees of difficulty in the book? Yes, you will find many different case types in the 35 case reports in the book. Each case is documented with pre- and post-treatment radiographs, cephalometric tracings, and superimpositions. For example, here is a case that's treated with temporary anchorage devices or TADs in a case report from Chapter 15 on interdisciplinary treatment. This patient presents with a class 2 malocclusion with facial asymmetry, canted maxillary-occlusal plane, and increased overjet. You can see she has a convex facial profile with incompetent lip posture and a deficient chin button. From the frontal facial photograph, you can see a significant facial asymmetry with excessive gingival display on smiling and a canted maxillary-occlusal plane. Intraorally, She presents with a class 2 malocclusion with an increased overjet of 8 millimeters and a 50% overbite. This minor crowding in both dental arches. In our diagnosis, we looked at her and said she is a class 2 malocclusion with facial asymmetry. The maxillary occlusal cant is canted down on the left. There's an increased overjet of 8 millimeters, minor crowding in both dental arches, a convex profile with incompetent lip posture and deficient chin button. The cephalometric analysis shows an AMB of 8 degrees and an SNMP of 49 degrees. We offered this patient a surgical option with maxillary impaction, mandibular advancement, and genioplasty, but she asked for a non-surgical option. And in the non-surgical option, we propose extractions of upper first premolars and orthodontic treatment with selective anterior intrusion with temporary anchorage devices or TADs to correct the maxillary occlusal cant. If she chose a non-surgical approach, she would have to accept the convex facial profile and facial asymmetry. This is the ClinCheck plan that we received. As the premolar extraction cases are closed, you can see upper incisor retraction, overjet reduction, and intrusion in the upper left anterior quadrant. From the buccal view, and this case was treated before the days of the G6 premolar extraction protocol, you can see space closure, overjet reduction, and intrusion. This is the superimposition view. In the superimposition view, we can see that the upper left anterior teeth have been intruded more than the upper right quadrant in order to address the maxillary occlusal cant. In the upper right corner, you can see the reduction in overjet, and in the lower right, you can see from the occlusal view the amount of incisor retraction. This is the patient at 13 months in treatment. You can see the extraction spaces are closed, but there is some spacing left in the upper arch mesial to the upper canines and in the upper midline. Here she is with the same photos taken with aligners and elastics in. You can see a buccal tab and a lingual tab. The elastic is worn from the buccal tab to the lingual tab. The tabs offer a point of anchorage for the incisor intrusion that's been programmed into the ClinCheck to express itself clinically. This is the patient after completing wearing the first series of aligners. You can see that the overjet has been significantly reduced. The overbite is within normal limits. Upper and lower dental arches are well aligned. Here are the final records after the completion of additional aligners and the before and after comparison. But most strikingly, you can see here in her smile photograph how the power of TADs has combined together with clear aligners can give us an amazing clinical outcome where we've decreased the amount of gingival display she shows when smiling, as well as corrected the maxillary occlusal cant. I'd like to introduce you to this website, clearalignertechnique.com. On this website, you can find out more about the book. You can see the contents of the book and the different chapter headings. This book is designed so that from chapter 1 to 6, it outlines the clinical workflow, case selection, software design, monitoring treatment, troubleshooting, finishing, and retention. From chapter 7 to 15, we describe the different types of malocclusions, the diagnosis, treatment plan, software design, clinical execution that's illustrated with 3 case reports in each chapter. You can also read reviews on the book from the Journal of Clinical Orthodontics and the American Journal of Orthodontics, as well as you can purchase the book in the language of your choice. What do you see as the future of clear aligners and orthodontics? I think clear aligners is the future of orthodontics. I practice in Vancouver, Canada, and my orthodontic practice is 80% clear aligners and 20% fixed appliances. In today's world, even patients as young as 8 years old are asking for clear aligner treatment. Parents are asking for clear aligners for their children due to the many advantages of less pain, ease of use, maintaining oral hygiene, and being able to eat anything while the orthodontic treatment is in progress. Most of all, the aligners do not interfere with other areas of the patient's life, such as playing soccer or a music instrument. Let me share a case with you. This little boy is named Jaden, and he was 9 years old when he came into my practice, asking for clear aligners. And I said to him, Jaden, why do you want to have clear aligners? And he said to me, Dr. Tai, I am the provincial martial arts champion for the province of British Columbia, Canada. I do martial arts all the time, and if I have metal braces in my mouth and I get hit during training or in a competition, it's going to cut my lips up pretty bad. Dr. Tai, could I have clear aligners? Well, look at this case. It's class 1 mixed dentition, deep overbite with fairly severe lower incisor crowding. And I said to Jaden, of course, we will treat you with Invisalign first clear aligners. Here is Jaden at 8 aligners in the first appointment back in my practice after 2 months. You can see that the overbite is gradually being corrected. There's some dental alveolar arch development. And here he is at 5 months at the end of phase 1. Both upper and lower dental arches are well aligned, the deep overbite has been corrected, the dental midlines are coincident, and we have left some spaces, mesial and distal to the primary canines, to prepare for the future eruption of permanent teeth. Here's the before and the after comparison. Here's Jaden on the day that he got his aligners on. And here we are bonding attachments. His mother was very excited and she took these photos. Here we are flashing our matching aligner smiles. Then Jaden sends me a photo and says, Dr. Tai, I'm very happy. I'm doing my jiu-jitsu with my aligners in my mouth. And then mom sends me a photo where Jaden won the gold medal. And she says, my golden ball and wearing your Invisalign. So as we think about the impact of clear aligner technology, not only in our practice of dentistry and orthodontics, but in our patients' lives. In the preface of the book, I write, as we harness the power of the digital world to move teeth and design occlusions, let us not forget that at the very core of our profession of orthodontics, we are changing smiles and changing lives. The future is clear.